Hi, I'm Dr. Shannon Trotter, board certified dermatologist, and I'm excited to be here with you today to raise awareness for a condition called GPP. And I have a special guest with us here today, Toshia, who's going to share her experience and her journey. Tasha, I want you to kind of tell us about how you were diagnosed with GPP and what is your story? What happened to you along that pathway?
Okay, sure. So my journey with GPP started a long time ago. It started when I was 19 years old. I started developing pustules in my scalp, redness, pain. I started feeling very fatigued. I also had a very bad burning sensation in my scalp. I first went to the dermatologist. I was told I had lice. Well, after doing the treatment that was prescribed for lice, I still had symptoms. So I went to visit another dermatologist and I was diagnosed with folliculitis. So that's how my journey started with GPP.
And so, how do they come about to actually make the diagnosis? So, it sounds like it was a challenge, which it is for us in dermatology. What actually led to the diagnosis for you?
So, what led to the diagnosis for me was going through a lot of several dermatologists. My current dermatologist now diagnosed me in 2020. He was already aware of what GPP was. He took a biopsy of my scalp, but just looking at my scalp and the symptoms I described to him, he told me possibly what it could be. And after being diagnosed in 2020 and getting treatment, my symptoms have been managed ever since.
That's fantastic. I think your story, though, it's not unique. You know, for a lot of GPP patients, it seems to be this journey of almost like a mystery, trying to figure it out for a while, visiting doctor after doctor, sometimes dermatologist after dermatologist, until finally they get an answer. And I think that's just a reality with GPP. It is hard to diagnose sometimes. It can present so differently. And patients where some present classic, right? It looks like the textbook, they walk in, we know, okay, you have GPP. They can be more subtle, like yours was earlier on, where it's kind of questioning, what is this? And it really takes, I think, an astute dermatologist just to put it on their radar to even have that awareness. Because we know you can have that pre-pustular phase where you have just scaly spots and doesn't look like much. Then you have that classic phase where people walk in covered in pustules and they might be really sick with systemic symptoms. Then you have that post, kind of flare phase where people might go back to a kind of a quiet baseline. And with it being rare, only affecting about 1 in 10,000 Americans, it's a challenge for us to really recognize this condition. Now, after your dermatologist made the diagnosis, you mentioned that you got on treatment. What type of treatment did they start you on?
Well, after he diagnosed me, he started me on a biologic, which I am currently on right now.
And it sounds like when you were diagnosed, were you started on this therapy kind of, monthly, or is this something you were given as a one-time infusion, or what was the process for getting started?
So for getting started, I had to complete some blood work. I also had to get in touch with kind of like a community or like a healthcare coordinator for the medication, which kind of went over what the medication is. They asked me to speak with the pharmacist since it was my first time being on a biologic, so I can learn how to do the injections. The injections are currently every 12 weeks. Um, so it was a big help getting started with the medication.
So treatment, it sounds like, has been successful. As we know, there is an FDA-approved medication that blocks that IL-36 pathway that has been helpful for treatment. If we kind of go back to, diagnosis, I think one of the things to highlight, and looking for the clinician, and trying to have those clinical pearls and maybe suspecting it is somebody like yourself that comes in with sort of that history of recurrent pustules that might be isolated sometimes to particular areas of the body. It sounded like you had some systemic symptoms when this came on too. Did you ever experience fever, chills, or, joint pains, things like that as well? Is that true? Biopsy sounds like was helpful. I know maybe not always helpful. And especially to highlight too, during that acute or flare phase, we often can't wait for biopsy results to come back to make the diagnosis. So what becomes important is taking that thorough history, which it sounds like the dermatologist did with you, being aware of the condition, the systemic symptoms, and then just having that awareness to make the diagnosis is really what sort of clinched it. Is that kind of how you felt in this scenario?
Yes, it is. With him being aware of this rare disease, I really think that's the only reason why I'm have manage my flares.
Mhm.
Without meeting my current dermatologist, I really don't think I would still be diagnosed.
Now, did you ever have a history of psoriasis before they diagnosed you?
No.
And I think that's important to highlight that I think people assume that you'll have a history of psoriasis if you're diagnosed with GPP. And we see plaque psoriasis in about 50% of GPP patients, but the other half doesn't experience plaque psoriasis. I think it's important to remind clinicians too that these are distinct conditions, GPP and plaque psoriasis, very different pathogenesis on what the predominant pathway is that's involved, and then accordingly have to be treated quite differently. So now that kind of you've gone through this journey, the diagnosis has been made, you're now on treatment with this medication that blocks that IL-36 pathway. How are you living life? Do you have freedom? Do you feel like we're not worried about flaring? Has it affected you where you have less anxiety? Are you still concerned about, will that GPP come back one day?
So no, I don't have any more anxiety and not nearly as bad as I used to before I got diagnosed and got started on treatment. I do have to be careful because I do have triggers that can flare it, such as my diet. I have to try to keep my stress down. And I also recently noticed sunlight. I can't stay out in the sun too long. That can also cause a flare.
People do have triggers, as you mentioned, diet relevant for you might not be relevant for somebody else. We know pregnancy can do it, infection, medications. Sometimes we'll see patients started on steroids, and as you kind of taper withdrawal, that it might precipitate a flare of GPP. And then we have a lot of cases, boy, we don't know why, right? GPP happens and it flares. So, one of the reasons we're chatting today is now we have GPP Awareness Day. So I want to just kind of get your thoughts. What does that mean to you that now there's a day dedicated to this condition that you've dealt with for so long?
What that means to me is that I don't think there will be many more people like me that had to go misdiagnosed. At least is what I'm hoping for. And I'm also hoping for that this day will bring more awareness to healthcare providers who are not aware of this rare disease from maybe healthcare providers like you who are aware of this disease to educate. And it also means that I'm not alone anymore. I'm being heard. I have a day of to talk to other people, a sense of community support. That's what the GPP Awareness Day means to me.
And Tasha, I just want to thank you for coming on and sharing your story. You're really going to help dermatologists like myself to be more aware of this condition, just to put it on our radar and really understand how it impacts you and your quality of life. So thank you for being so brave and sharing your story with us here today. For those of you that want to learn more about GPP, go to gppandme.com. Again, the website is gppandme.com.